Our patient had pretty dramatic, embarrassing gynecomastia that stopped him from taking off his shirt in public for the past 20 years. But in just one morning, we were able to solve his problem. And in this video, we're gonna hear from him. We're gonna learn a little bit about his story. And you're also gonna see what the workflow is of gynecomastia surgery itself. And you're gonna hear his experience having gone through it. So my name is Dr. Kennedy Hersi. I founded Two Palms Medical Center. We are a men's only cosmetic surgery practice. We focus primarily on gynecomastia removal surgery and 360 lipo. Stay tuned to watch the video and learn a little bit about this procedure. As an introduction, can you tell us how old you are, how tall you are, and how much do you weigh?
Yeah, I'm 6 foot tall. I'm 34 years old, about 225 right now.
And how old were you when you first noticed the gyno?
I had to have been 13, 14. Was when I started getting picked on for it mostly.
Oh,
yeah, exactly. It wasn't even me.
Yeah.
Of course, to me, I was just like a kid, but then it was others that made me aware of it.
Yeah, who are those others?
Well, first being my brother, and that went on for a long time.
He didn't have it?
No, but I got bigger.
And over the years, you sent me a photo of when you were slim and you still had it.
6-pack abs, and yeah.
And over the years, has it gotten worse?
Yeah, I think so. I think so. The gland itself, maybe not, but putting on weight certainly exacerbated it for sure.
Good morning. We are about to start our gynecomastia case for today. And the good news for him is that his results can be dramatic. Once those masses are gone, his chest is going to be significantly flatter. So what we're going to do now is we're going to mark him up and we're going to do our preoperative plan. We're going to make our access points from his 3, 6, 9 o'clock position on the areola. Another question I get asked often is, do we do anything to the areola to make the difference in appearance that people often see afterwards? The reason why there's such a significant change in the areola after surgery is because right now that mass is stretching out his skin and it's causing the areola to be artificially larger than it is. Once that mass is removed, it's going to shrink and darken. Through nothing that I'm doing to the areola itself, it's all related to removing the mass behind it. So we're going to make our mark to the mid-sternum, our sternal notch, and then we're going to go across to the 3 o'clock position. The inferior margin of the anesthesia will be this dotted line, which is going to go down to his inframammary crease. We're going to make our access point. So he was asking me to be aggressive with lipo, and I was telling him that I don't think there's much fat on his chest. I think when I palpate and I feel, this all feels like gland. So I'm gonna do the lipo more to release it, but I don't think there's very much fat that's gonna come out. So the good news for that is that the result is gonna be a lot more dramatic because of that. I tell guys that it's not a good idea to go for the surgery for debulking for fat. It's better that they do fat loss just because it's hard to get a smoother contour. But in this case, because we're removing a solid mass, the contour will be smooth because it's just like a very large, like if you imagine like a chicken breast, that kind of appearance and shape, that's kind of what's sitting on his chest. So it should be a nice smooth result. So I'm gonna have him pivot right there and then So we are 1 day post-op from your gynecomastia surgery. How are you feeling?
I feel amazing. I feel good. I feel really good. Just got those tubes out. I feel pretty solid.
And this whole experience, was it what you expected?
No, it's actually way better than what I expected. You know, as you guys were all courteous and kind, and I mean polite and informative, and I was actually really surprised by how well everything went.
What did you think would happen?
Well, most of my doctor's experiences were kind of felt like you were just there for just the operation, that's it. And I kind of felt like it was going to be just a, run through the cattle chutes and get done and get sent away. But I think what happened was I got to kind of meet a couple new friends and walk through some processes, had some jokes and stuff, and just laid down and had a couple hours worth of conversation and woke up feeling amazing when I did take a nap. Yeah.
So you're referring to the surgery?
Yeah, the whole thing. So straight in, felt comfortable all the way through the pre-op. Every question and then some were answered, I mean, the surgery was great, the whole thing.
You remember the first poke of the anesthesia?
Yes.
Was it painful?
No, just a little burn. Nothing bad at all. Not any worse than any other shot I've ever had.
And that's normal. The lidocaine causes the burn, so there's two different points of sensation. There's two different opportunities for pain with the anesthetic being applied, the poke of the needle and the burning of the lidocaine itself. What about the lipo? Did you feel that?
Not really. No, not really. It was more like it felt like I could feel a push, kind of, but no, there was no actual sharp pain or anything.
Your glands were large,
right.
And overall, the removal of the gland portion of the case, on a pain level, how was that?
Well, considering how good you guys were at listening to every sound I made and addressing it, I'd put the scale low. It'd be low. So on a 10, momentary 3 and 4s, but for the most part, it was almost all completely painless. So those were just small moments, though, and they really weren't bad.
Standing up after surgery, after that long morning, and how'd you feel at the time of leaving the office?
I actually felt a lot better than I thought I would be. Yeah.
And
a little woozy, a little bit, just kind of needed to get the blood moving again. But I felt great. I felt great getting through it, for sure.
So what ended up happening when you got back to the Airbnb after?
The first thing I had to do was knock down a triple cheeseburger from Whataburger. That was number one. But that was number one. Did that, knocked out a couple bottles of water with some minerals, and we watched a movie, and then I took a nap for, I don't remember how long, but it was a couple hours.
Any issues sleeping overnight?
No. The only slight issue I had was with the tubes, and that was not any problem of the tubes. It's just, I move around a lot, so I slept sleeping up mostly, and it was good sleep, actually.
And did you take any Tylenol last night or this morning?
I did this morning, yeah.
You took some Tylenol?
Mm-hmm. And antibiotic.
And in terms of pain this morning and the Tylenol, how would you describe the pain?
For me, it wasn't. It was more just discomfort, just in the armpit, just from the tube, because I'd just been shuffling around a bunch and moving it a lot. But pain, I mean, the chest, 0, which shocks me, to be honest with you. But 0 under the armpit. That was only with movement and something actually pulling on it, So 3, momentary 3s.
And so mind you, Tylenol, really no medication is particularly effective if you have a foreign body causing the pain. Yeah. And the tubing is just going to naturally be uncomfortable almost no matter what you do. Taking Tylenol is appropriate and completely reasonable, but it has really minimal impact if the foreign body is still there driving the discomfort stimulus, just FYI. And the experience this morning, just now, having the drains removed, how would you describe that to people who are wondering?
Way better than what I thought. What I worked up in my mind was way worse than what it was here. The tube came out, it was 3, 2, 1 countdown. It was out, just like that. No big deal. It was actually the adhesive pulling off was way worse than anything else. Yeah. And that wasn't real pain. That's just like sissy pain,
No, it's uncomfortable, which, as a reminder to anyone watching, please trim your armpit hair.
Do that.
The week before surgery.
Yeah.
Helps to minimize the pain of the Band-Aid coming off.
Agreed.
And as a kid being taunted, what did you have the label for what it was?
What did I have? Like, what were the?
No. Like, when did you figure out that this was like legitimately a medical problem?
That wasn't until I discovered Google and deep diving into Google, and I found it. I found it on Google because I had done what felt like tens of thousands of push-ups and bench presses and everything you could do to work out your pecs. And no matter what I did, I had six-pack. I had the whole, I mean, I was a state runner and everything, and this didn't go anywhere, and it apparently wasn't common knowledge. Gynecomastia, if I even pronounced it correctly, was not something that anyone I knew was aware of. Just man boobs, right? You just had moobs, whatever kind of awful thing you want to call it. And so, yeah, so I didn't know I had a excuse to have the shape that I had until much later, which was even more traumatizing for me.
So if you had to ballpark it, when did you like find out?
Probably in my 20s.
Like early 20s, late 20s?
Early 20s, yeah.
So you went through your whole teenage years not knowing that this was a treatable thing, and then in your early 20s online is when you found out?
Yeah, that's when I started actually learning about it a little bit.
And did you ever try like tamoxifen or any of those medications?
No, because I'd read that was early. If you catch it early, which at that point it didn't feel very early considering I had it for so long.
Yeah, I doubt it would have been effective whatsoever for you. What about like things that could have triggered it, like anabolic steroids?
No steroids, nothing.
If you've heard about it in your mid-early 20s and now you're in your mid-early 30s, what prevented you from acting sooner?
Well, it felt like taking time off work was not going to be acceptable. Also, there was a stigma amongst males that you should just accept it and just kind of move on. It's something you should deal with, and that's the way I felt. I felt like I wasn't allowed to do anything about it because it's just the way I am kind of deal. I don't know. I'm not entirely sure how to explain it, but it wasn't until recently it just clicked. Why am I going to deal with something like this that clearly stopping me from doing things with my daughter? Like, I don't want to go to the pool with my daughter. That's something I can't not do. You know what I mean? So maybe it's the kid finally got me to start wanting to take care of myself.
Did you ever take your shirt off at the pool?
No, zero, none, not at all.
Outside?
Even into my 18, 19, 20s, no, even then. Because it was even worse having, when I did have a six-pack and then I had these, it just felt so strange. And then you gained a little weight and then it looked, they just even got even worse,
So, I mean, your brother knew, close people at that age knew, but then, outside of that sphere, like you were able to conceal it from everyone, I imagine.
Not sort of, because even whenever I worked jobs where, I worked hard manual labor and I'd sweat and I'd get a real wet shirt, and it'd lay on my body.
Oh, no.
I mean, it was
it was like an outline.
Yeah, and it was so I would walk through the store doing this too, pushing my shirt out, and I mean, I was so self-conscious about it my whole life that I'd be adjusting my shirt every time I get out of the car. Every time, I mean, it's always been in my head. So it's been a pretty big move to do this.
Oh man, that's amazing.
I unlocked superpower today.
Oh,
yeah, for sure. Feel good.
The compression shirts, did you?
Yes, actually, yeah, I do. I own a couple that you pull down and it takes you 5 minutes to pull it all the way down. Yeah.
So, but that's not practical to use all the time or consistently.
No, especially not in Texas.
Yeah, no, it's fair. And at what point did you start doing active research into your own surgery?
Probably 23, 24, started doing active research, and then I kind of buried it for a while. And then, 27, started rolling around, and then I really started digging deep into it. And that's kind of how it go phases, where I'd get on it and then I'd leave it alone, and then oh no, it's too much money. Then I'd leave it alone, and I finally got to the point where it's like, almost any amount of money's worth it.
Yeah, well, I mean, well, your motivation's so strong. I mean,
Yeah.
it's like very,
Yeah.
which kind of leads into what are you looking forward to most now that?
Man, I just going swimming. Yeah, going swimming, being able to just take my shirt off and not have to feel like. And I always knew it was irrational. Not everybody's staring at you, but I always had that feeling. I couldn't shake it, you know. And just just the freedom to be able to just, I don't know, you know, go suntan outside and not worry about it, you know. Simple stuff, really.
Oh man.
Not have to wear a upsized life jacket because of my chest. You know what I'm saying? Be able to wear this regular size shirt I should be able to wear. That's the small things you don't think about.
Yeah, that's huge. It's huge.
Oh yeah.
To anyone watching this, they probably have gyno or are thinking about this surgery. Any words of wisdom?
Don't wait. Do not wait. It's not worth waiting for. Literally every single day, every single time you don't go swimming, you don't go to that cabin, you don't go water skiing, you don't do, they're just things in life that are further and further and further behind you when they should be in front of you. You should be doing them, being active, enjoying your life. The money, you can make it back. Trust me, it's worth it. Save up, get it done. That's it. I mean, honestly, no BS. It's not worth waiting. If I could think of all the cool things that I didn't do, I mean, it's a huge list of things I didn't do. And all you got is time. Time is currency. And I'm telling you right now, whatever it costs to get this thing done pales in comparison to what you lose in life. So get it done. That's what I say.
Your results. So far, so good.
Awesome. Yeah, awesome. Surprisingly, actually.
What did you imagine?
And it was nothing saying, when I say surprisingly, I always set myself up with low expectations. This is the way I am to protect myself, I guess. But what I was expecting was just kind of like a moderate change where I'm like, oh, cool, I got that done, you know. And now I'll have to lose another 20 pounds. I actually know what I got, but I know what I got done big time without losing the weight, which I will be doing. And yeah, I'm blown away, big time, big time. I mean, there's actually a fault, like a flat. It's completely flat here. And the fact that I'm not in excruciating pain is amazing to me, by the way. I expected to be in a lot of pain. I expected to be like moderately happy about it, but I caught myself like just ghost grinning all day today, you know, so expectations were a lot lower than what I got. So I'm super, super excited.
No, that's beyond that's the best sounds I could hear. I'm very grateful that things have gone smoothly.
Oh, I'm grateful for sure.
So during our appointment tomorrow, because he's an out-of-town patient, we're going to be doing the ultrasound, and I'm going to be demoing to him how to do the needle aspiration, and then I'm going to be providing supplies so he can take with him and drain as needed, and I could walk him through over the phone. So we are about 2 days post-op, and looking at his recovery, he looks great. I don't see any significant swelling around the operative area. Most of the skin marker has been washed off. He has minimal bruising. So things to look out for the next couple of days is I'd anticipate more bruising to set in. And the bruising is going to start kind of here in the operative area. And then over the next few days, it'll start migrating downwards with gravity. So if that happens, don't be surprised. Otherwise, we're going to look with the ultrasound now, but it's not really the potential space, the empty space is right here. And as I'm feeling, maybe there is a little bit of fluid. I'm feeling for what's called a fluid wave. And this is the area that we anticipate will be numb for the next number of months. The sensory nerves were damaged with the surgical trauma, and nerve recovery is very slow. So 6, 9, 12, 16, 18 months, it's not uncommon for it to come back. And it might start off with like tingling or paresthesias before it comes back to normal. Those are all things to watch out for and be mindful of. He has a lot of internal stitches holding the skin together. And right now I'm putting a little bit of tension on it. But as I've mentioned before, it's a lot of redundancy to the skin of the chest, so it's pretty hard to put a lot of tension on them. But the scar will mature, those stitches will dissolve over the number of months. The holes in the armpit, if he raises his arm and pivots a little bit, it's still a little bit open. You can see the access points right there, and it's already closing. No stitches required to close it, but he can wash it in the shower. Did you wash it?
Yeah.
Any issues?
Typical ends, yeah.
Any problems? No, did it burn or anything?
No, a little sting on both of them, yeah.
But that'll quickly scab over. Right now, I'm encouraging him to wear bandages over the access points until they close up and dry out a little bit. After that, you can stop wearing it. It helps you want to minimize the chafing from the incision to the compression insert.
Right.
But once you feel like it's matured enough and dried out enough, you don't need to wear the bandages anymore. Okay.
Sounds good.
All right, so now we will look with the ultrasounds. Looks like it's kind of layering down towards the bottom. On the ultrasound, we saw a visible fluid pocket on the left side. On the right side, not so much. The concept with this is you go where the money is, where you think the fluid is, where it feels the most likely to be. Just start there. All right, so on the thing, this is a 30 ml syringe. It takes a little bit of force to break the vacuum. So you get it rolling, and then you brace, and then 1, 2, 3, pierce the skin. And you kind of try to milk the fluid to where the needle is. And so this, we evacuated, so about 15 milliliters, 1.5.
Impressive.
No, nothing to it. Congrats to our patient.
No, congrats to you for having this place set up the way it is. It was, if anybody's listening to this part of it, I will say, if you're from out of town, I drove almost 7 hours to get here, and I would have stacked another 7 to do it again if I knew this was exactly how it was going to go. So, big thumbs up.
We'll leave it there. Thank you, sir.
Of course. Thank you. I feel great. Oh man, this is literally,